It's a great pleasure to introduce our distinguished speaker, Dr. Rami Komrukji. Dr. Komrukji is the Vice Chair of the Malignant Hematology Department at the Moffitt Cancer Center in Tampa, Florida. He's a senior member of the Malignant Hematology and Experimental Therapeutics program at the Moffitt Cancer Center and professor in medicine, including Oncologic Sciences at the College of Medicine at the University of South Florida in Tampa, Florida. Dr. Komrukji is expert in myeloid neoplasms, where he led several clinical trials and lectured worldwide. His work paved FDA approval for drugs in myelodysplastic syndromes and myelofibrosis. He has authored more than 300 peer-reviewed manuscripts, 20 book chapters, and more than 700 abstracts. He served as a member on the MDS Panel for the National Comprehensive Cancer Network, member of the NIH MDS Natural History Study Steering Committee, and aplastic anemia and MDS Foundation Board of Directors. He is peer reviewer for several medical journals. And I'm proud to say that Rami was my classmate. And I'm so happy to have you here today, Rami, to speak to us about the leadership journey, how I did it. Thank you so much.
Assalamu alaikum. I'm Rami Komrukji from Moffitt Cancer Center. It's a pleasure to be here virtually talking to you, and wish in the future we'll have the opportunity to meet in person. I'd like to thank Dr.Shaheen also for the kind invite, and congratulate her on great efforts bringing this meeting to Gaza. Dr. Shaheen asked me to talk about leadership journey, how I did it, and I'm honored and humbled to be doing this talk. Obviously, many of those things I will be discussing are really general advice. It cannot be probably individualized all the time. It's varied by circumstances, but I'll share with you a few tips that I thought I learned over time of things that I've done right from the beginning and things I wish I had the chance to go back and do them. So I think obviously when you think of building a career in medicine, I can't emphasize more that the most important first step is really building a strong base. And this sounds natural. Sometimes we don't recognize the importance of it at our stage of career or life, but the best thing you can do at this point is really becoming a good physician and a doctor, understanding basic science. For you who's going to be pursuing academic career, things may not make sense at this time, but there are many times I wished I would be back to medical school and read in more details about basic science and learn the concepts, because you'll have to learn them later on. And what will always distinguish you from anybody else is really having the strong medical knowledge, the general strong medical knowledge, the clinical skills, and also forming early on your good habits, being disciplined, communicating well, all those things. So there is no doubt the most important thing, and your focus as a medical student should always be, building a strong base. The other thing I wanted to discuss is really one of the other things to do while preparing for your career is really to acquire different skill sets. Those will be very helpful in the future, whether on a practical day-to-day use or to also advance your career. So there is always opportunity to obtain additional degrees such as Master of Public Health, Clinical Research and Epidemiology, Master of Science, for those interested in pursuing a physician scientist pathway, for example, obtaining a PhD, for those more interested into administrative route, obtaining an MBA. Many of those are available online nowadays, and even if you cannot obtain the full degree, there are so many courses online that one can improve their skill set by attending so. Then there are definitely computer skills could be helpful, from something as simple as typing fast to more sophisticated software that can help you with analysis or in your practice. And for those interested in pursuing academic career and research, learning basic statistical analysis is very helpful. It will enhance your understanding of the medical literature, but also will be very helpful. So for instance, I think you will be having a dedicated talk about how to build database and some basic of statistical analysis. I personally learned that during my residency and fellowship, and had been one of the best skills I've learned, because to date I do most of the statistical analysis for my studies and research by my own, unless it gets very complicated. Then it comes to choices, obviously, and the advice, again, as simple as it sounds, is really you have to follow your passion. Pick a specialty you like and you are passionate about, because this is something you are going to be doing for the rest of your life. And I always bring the example of people that do things as a job and people that do things as a career and a passion. There are people that just come to work from 8 to 5, finish the work, it's a job for them. And there are people that this is their life, their career. So you definitely want to be passionate. You want to be doing something that you will be happy doing every day for the rest of your life. And at the beginning, it may not be easy to decide what is that. And there is many factors that play into that equation. So you'll have 2 points in your career probably where you can narrow those choices. So one is at the end of the medical school, where you decide, are you more going to go into a surgery versus medicine training, based on obviously your passion, your skill sets, and opportunities sometimes, obviously. Then when at the end of your residency also, you'll have that opportunity again to decide, are you going to stay as a general practitioner, are you going to subspecialize, and what to pursue. And sometimes it will be in between 2 subspecialties, for example, but then you'll have to narrow that decision, first based on your passion, and second based on the opportunities and what serves better your needs, the area that you are going to be practicing in, etc. And in the same line, when you are trying to narrow your choices, you have to set your career goals. And in general, there are 2 main tracks, obviously. An academic, which could be a clinical investigator conducting clinical trials, seeing patients in an academic environment, or physician scientist, who they have lab, they can conduct translational research and still see some patients. For those interested into the academic pathway, obviously, you need to strengthen your skills by reading a lot of literature that will let you know how to write an abstract in the future, how to write a manuscript. I can't tell you how many young people work with me that the first time they write an abstract, it sounds that they've never read an abstract. So, this is very important. You want to try to conduct research as simple as it could be, whether there are case series of patients and observation. Partly, obviously, that will help you improving your chances, improving your CV when you apply to programs, but also you will learn the skills that are needed. And as a general rule, every work you do, you should publish. So that's a rule I set for all my fellows and junior faculty, that there should be no project goes without being published. And also, obviously, if you decide early on that your career goal is academic and you have certain area of interest, you pursue doing electives, observership in areas of interest if that opportunity is available. Some people are more interested in building a good private practice, and there is really no right or wrong choice. I talk to some friends that they say they will be happy seeing 100 patients, they enjoy the interaction with patients, they get the satisfaction from helping patients, and they will not write one manuscript. And there are some people that really have the passion of being on the edge of research, publishing data, moving the field, taking it a different level. So both are right choices. I think you have to fit them according to your passion, to the needs around you. If you are pursuing a private practice or just going to be a clinician, you have really to master bedside skills, see as much patients as you can, build as much knowledge as you can. And obviously also in private practice, or if you are building your own practice, there's always going to be a business aspect for it. So you have to start learning a little bit more about the business aspect of medicine, which actually dictates a lot of what people do, whether it's in academic or private practice. That's the reality. Another advice is seize opportunities, whether it's in career choice or selecting your mentor. So life is gonna take turns, and you'll have to seize some of those opportunities. You may run into somebody who's willing to give you opportunity or mentor you, maybe not in your first choice of what you are thinking you are going to be doing. Sometimes you have to rethink of that and take it. I went into hematology. I was interested both in lymphomas and myeloid diseases. Happened in my fellowship that the person that classified leukemias is in that university. He started giving me opportunities to work, so I seized that opportunity, having a wonderful mentor that will introduce me to the myeloid experts, and focused more on myeloid diseases, for example. Another very important advice, which I think many people are aware of, is really building your network. Nowadays, something that exists that probably even didn't exist at my time when I was in training is really the social media. You can have a lot of connections and opportunities through social media, connecting with physicians worldwide. That's very important. Colleagues that you meet during medical school, residency, and workshop. I attended so many workshops during my training, something like the American Society of Hematology Clinical Research Training Institute, and obviously you get training on how to do studies, how to read literature, etc. But the number one thing that I gained from that is really all those people that I attended the ASH CRTI with, down the road became leaders in different institutions, and I had this network of people knowing me, people that were at the same level of career, and we grow together. Also, that extends to beyond the medical network. Don't be just focused on the medical network, because obviously there are benefits of collaborating with so many other people that will bring creative ideas for you. And building your network other than social media could really be attending courses. Again, some of them now are virtual, online, or in person, and that is another very important step you have to think of ahead. And then on a personal level, obviously, organization skills. So this is, again, seems very simple, but it's very important. This reflects to any stage in career. When you are studying, you have to be organized. Maybe I was a little bit more on the extreme side. I would set exactly how much I'm studying. I would write the time I started studying. If I took a break, even for eating, I will discount that. And I will come up with a network of like 16 or 17 hours studying in a day. Same thing, organization skills in your work, how you're going to organize the flow of your clinics, how you're going to communicate with patients, and how you're going to communicate with referring physicians. Those are very important, and communication with people is key. For example, in my practice, we see a lot of patients for second opinion and referrals and consultation. And when I see those patients, I immediately on the spot, if I have the phone number for the physician or their email, I'll send them an email. Thank you for referral. I saw your patient. This is what I think. Try to be organized on how you communicate in emails. Maybe set an hour in the day that you are going to communicate back and forth, or if you are really active, you have the ability of answering on the spot, flag things that are important so that you don't miss replying back. And remember, in communication, always a very important aspect, as simple as it sounds, is never lose your temper replying back to people. Those capital emails should never exist in anybody's email. If you are like mad about something, or something really came across annoying to you, sometimes maybe write the email and don't send it. Just wait for the second day. When you calm down, you'll always have different perspective on things. Again, those seem to be very simple things, but those are very common pitfalls that people fall into during their career. And I think part of the success is always really paying this forward. Your success is always going to be even more if it's a teamwork. And I think something I learned here in USA is that really teaming up with people sometimes obviously could be even selfish, because your ability to succeed is going to be way more if you have a successful team and you bring all those people together up. Then obviously it's very rewarding to help other people. And part of what we do in our career is really helping other people, having other people's career flourish, collaboration. During this, obviously you have to set rules and be fair to everybody, whether this is in your practice, how you're going to divide the practice, whether it's in research, who's going to be the first author on a paper or who's going to be the senior author on a paper. All those things is always very nice to be set up front. I always say the best way is to treat people as you like people to treat you, and it's really one of the best parts in our career is teaching other physicians, paying the success forward to other people. Then obviously, you have to have a vision and a dream, and there is nothing wrong about aim big and be very ambitious, and then divide that into steps during your career. You could say, okay, like I want to be very successful. What can I do now today? I think as we discussed, today probably the best you can do is building your strong base, becoming the best physician you can be, adding some skills, starting to build your connections. But you should aim big. Think always out of the box. You have to be creative. Things could be challenging. During the journey, you will have failures, so you have to be ready to have a plan B and get up and move again. When you get to a leadership position, I think there is always difference between leaders that have a vision and somebody that micromanage. You never want to be somebody who's micromanaging everybody else. You have a leader is somebody that will guarantee the success of the team, never micromanage, and have that big vision of how to achieve things, never into the details. You have to surround yourself by people that are skilled, that can get the day-to-day things for you. A leader is a person with a vision and a dream. That's what it comes to when you get to that point in your career. So just to summarize this and briefly put it in perspective of, I want probably just to give an example of my journey, as Dr. Shaheen asked me to talk about how did I do it. I started obviously focusing on studying hard. High school exam ranked the 7th in my country in Jordan. I went to medical school in Jordan, really focused on building my background. Things I wish I could go back again and study is more focusing on biostatistics, understanding basic science. I spent a year or two in transition, preparing to come to the United States, pursued my training at Case Western Reserve, and then Hematology Oncology Fellowship in Rochester. And my program director, actually, I was going to spend a year extra in transplant, advised me to combine it with the third. So as you have good mentors, they usually will give you helpful advice and provide you opportunities that usually does not exist sometimes. As I mentioned, I met one of my first mentors there who was focused on this myelodysplastic syndrome disease. That basically provided me or opened the door for me to become specialized in that area. I did a Master of Public Health and I didn't finish the degree, and that's one of my regrets. I wish I had the time to go back and do that, but I still gained strength of that. I applied to different workshops, and again, many of those are now open international. ASH Clinical Research Training Institute, for example, for me, those are all hematology oncology based. Southwest Oncology Young Investigator Training, and then when I, advanced in my career, I attended the Physician Leadership Academy that I learned many of those skills that again seems to be very primitive, but you learn them over time. When I finished my training, my first job was at the University of Cincinnati, where I did hematological malignancies, and then I was recruited to Moffitt as a clinical investigator and expressed interest more in leadership. So I led the MDS program. Then I became clinical director of Malignant Hematology department, where I learned the clinical operations, then section head, and currently I'm the vice chair of the department. I think the skills that you need to deal with people and leadership position are sometimes different from the medical skills. At one point in your career, you will master the medical skills, but you'll learn every day how to deal with people, how to tackle challenges and solve problems on a daily basis. Those are, alhamdulillah, some of the achievements during my career. During my clinical investigation work and studies, I was able to develop 2 drugs that are approved now for blood diseases by the FDA, luspatercept and Pacritinib. I've published more than 300 peer-reviewed manuscripts, including senior author in New England Journal, wrote 15 book chapters, including MDS chapter for CISL medical textbook, presented nationally and internationally, and really the pride is really building one of the best programs worldwide in MDS here at Moffitt. Alhamdulillah, ranked top world in MDS top 10 in this disease, and among the top 1% of US physicians in cancer over the past 10 years. And finally, last year, honored to get the King Hussein Inaugural Cancer Research Award in recognition of those achievements. I think as I get older and wiser, when I think what's the most important, really the legacy is mentoring and training many successful young physicians who will become world leaders or very successful clinicians. Early in my career, I was so driven that I want to publish as much as I can manuscripts, but later you learn that really it's more the time and effort you invest in people that pays off. Having junior faculty and trainee that you train is really the legacy that I think will carry over so many generations, helping many patients as well, and people will always remember your help and your role in their career. With that, I'll stop. I went a little bit over time, I know, I'm sorry. And also definitely to acknowledge my family. All of this is hard work. It's going to take you away from your family, and it needs a lot of understanding from your partner, from your family, and support. You always have to push yourself out of your comfort zone. And inshallah, all of you will be very successful. Again, those were very general advices or tips. Hopefully you find them helpful. If anything is needed on a personal level, I'm always happy to provide help and advice. Thank you for listening.